Across the country, California's health leaders call the current surge in COVID cases, quote, horrifying. And hospitals from 4 major cities remain struggling the most, with resources and frontline workers being stretched to their limits again.
The United States just reported the second highest single-day death toll since the pandemic began. Nearly 2,600 people lost their lives.
There's only so many 12-hour shifts you can do in a week.
It's taking an emotional toll on frontline healthcare workers like Dr. Scott Samlin, an emergency room doctor in Indiana, which has the second highest COVID hospitalization rate in the country.
Every day it's the same. COVID patients, people sick, people on ventilators, people dying.
This hospital in upstate New York is preparing beds and equipment for an anticipated surge during the holidays.
December and January and February are going to be rough times.
In California, the state reported a record number of new cases and hospitalizations Tuesday, with more than 7,500 new cases in Los Angeles County alone.
We do have a choice to make, each one of us. Do we want to be part of the solution to this horrifying surge, or do we want to be the problem?
On Tuesday, a CDC panel recommended healthcare workers and nursing home residents be the first to be vaccinated against the coronavirus.
Ultimately, there will be enough vaccine for everybody in the United States that wants to get a vaccine to get a vaccine.
As the UK prepares to roll out its vaccine next week, Trump administration officials say the first shipments of Pfizer's vaccine will be delivered to the U.S. by mid-December.
Tomorrow, the United Nations General Assembly begins a special session on the response to the pandemic. More than 100 world leaders will deliver messages. President Trump is not one of them. Instead, the Secretary of Health and Human Services will speak for the United States.